Hello, I'm Dr. Stephen Olmos, and I want to demonstrate the phonetic bite registration or sibilant phenome registration. This technique is done with a bite stick. It's a segmented instrument that can be broken off at the appropriate dimension to capture this phonetic position. And before we start, before you capture a phonetic position, which is a three-dimensional correction that gives tonus to the airway and decompresses the jaw simultaneously, you want to make sure that the patient's muscles are relaxed as possible, especially if you're treating a chronic pain patient. So prior to doing this technique, we would have used the MP laser system to reduce inflammation in the joint and in the masseter muscles as well prior to doing this technique. So we'll do about 30 seconds laterally, 30 seconds posterior joint space, and then 30 seconds with in the long axis of the superficial masseters. So 90 seconds each side will reduce the pain levels by 90%. And the decreased nociception to the brain will result in relaxation of the muscles and a more normalized function. Okay, so after doing so, then we can begin the process. It's important that the patient is comfortable, that the patient is not really concentrating on the technique. I always like to try to distract them, get them to think about vacation or something other than what they're doing so that we can get a more true representation. This is an autonomic function, so if they're thinking about it, they can change the dimensions and then it's less accurate. Okay, so we're going to ask the patient to count from 66 to 77. And as they're counting, we're going to look at the anterior space between their front teeth, and we're going to mirror that, and that would be optimal. However, that varies person to person, and as a result, if the minimum speaking space does not allow for enough posterior joint space for the appliance that is to be produced, then you have to go within the range. So the range at minimum is 66, and then as you get into the 70s, the mandible drops a little more, and that increases all the way to the maximum opening, which is the rest after 75. Okay? So any of those verticals can be picked depending on what kind of appliances that you need. And so this device here can be purchased through Diamond Orthotic Laboratory. And also on their website, they also list how much vertical dimension you need for each type of appliance. So whether you're making printed appliances or whether you're making acrylic versions of these things, then so this would be a printed version here as opposed to acrylic versions here. So these all have different dimensions, and whether you're making appliances for sleep or whether you're making appliances for chronic pain, all of those dimensions need to correlate with the space that you're capturing. All right, so just count from 66 to 77.
66, 67, 68, 69, 70, 71, 72, 73, 74, 75.
I'd like to demonstrate the technique. It's important, as I said, to try to capture this in a comfortable mode and to make sure that the patient's comfortable with the device before actually taking the bite registration. If you bring something towards somebody and they're not ready for it, they're not familiar with it, then they're going to back away. So I always try to keep the device out of sight until the last little bit of placement. Okay, so we'll go ahead and ask the person to count from 66 to 77, but we're going to ask you to think about something that you like to do for vacation. So what's your favorite thing to do for vacation?
Go to the beach.
Okay, so you're on the beach. What do you like to do at the beach?
Just
lay in the sand. Okay, so you're laying on the sand. It's a beautiful day, looking at the waves. That's what I want you to think about as you count from 66 to 77. Okay, so can you go ahead and do that for me? And go ahead and count.
66, 67, 68, 69, 70, 71, 72, 73, 74, 75.
Okay, so what we're looking at is how much space we need. So these start out at an increment of 1 millimeter. The first one is 2 millimeters, then 3 millimeters, 4, 5, all the way up to 10 millimeters. Some of your patients may have an open bite. You may need to use the larger range. The little diamond in the middle is just for holding the device, because we need to make a transfer here with your assistant. Don't try doing this with just by yourself, because you won't be able to stabilize this and the jaw can move. So we can see that she needed, for minimum speaking space, probably 3 millimeters would be ideal. So we just simply break this off here, and we'll go in and check it. Can we have you rest your teeth on there for us? And now what you need to do is look back here and see, do you have enough room? But I can see that there's only maybe a 1/4 of a millimeter space between those teeth. Now that's ideal for her, but it wouldn't be ideal to make a day appliance. So I need another millimeter, so I'll just take that off and we'll try that again. Can I have you rest on that, please? So even though you're capturing the front, you have to be looking at the back to see if you have enough room. And that's about as thin as I could possibly get for this bite registration. So I'm making a day appliance, I'm making a night appliance. So this is my minimum. So this is what I would make the day appliance to. And then I would tell the laboratory to add a millimeter to this in order to have enough vertical to make a nighttime device. And in this patient's case, I'd be making an ONP. So I'm going to need a little more vertical to produce that with an anterior disclusion and the ring on there. Okay, so we'll demonstrate. So I'm just going to ask you to count, and somewhere along the way I'm going to say stop, and then I just want you to freeze in that position. I'll demonstrate for you, okay? 66, 67, 68, stop. See how I froze? Okay, then I'm going to put this on top of your tooth, and you rest on it just as you did, and then just don't move after that. Okay, that's how we're going to do this. Okay, so let me hand you that. There we go. So your assistant will be holding the syringe for you, and then you go to place it, and then we're going to make the exchange so that we can keep this mandible in exactly the three-dimensional correction that the speech is producing. So can you do that for me? You're at the beach, remember? You're thinking about the beach. Okay, so 66.
66, 67, 68.
Stop. Okay, we'll try that one more time. That was pretty good, but you just kind of moved a little bit there. But okay, back to the beach. Okay, go ahead.
66, 67, 68.
Stop. And then just rest on it. That's perfect. Now, if you can hold that just like that without moving, okay, and very critical that the assistant holds that. And very often your patient's tongue is going to be in the way, so you ask them to please move their tongue, but not their jaw, so that you can get the material. And be sure that the material flows all the way through, so you can be sure that you have a good bite registration. And now this takes about 20 seconds using the Best Bite material produced from Diamond Orthotic Laboratory. And this is the best stuff because it's hard enough that they can trim it, but not so hard that it just disintegrates and crumbles. And it has only a 20-second set time. So now you go back and check and see this is rigid. Please keep biting on that. That's good. Okay. Your assistant will come around to the other side. They will then grab that little device, and then I can come around to the other side here. And now we have this well centered. Now we can go back, and again, doing a very good job of keeping, and you can see the material is flowing all the way through because her tongue, she's moved it to the other side to help us out a little bit there. Okay, so that is the phonetic technique. Very simple, only takes a few minutes, and now you want to be able to decide what kind of, the devices you have now. You've got it mirrored. Sometimes there's too big a discrepancy between the daytime and nighttime dimensions that you need for these. So you may have to take a second bite for the night if you're not within a millimeter or so of the difference between the vertical you need for a day and the vertical you need for night.